Good morning, Mr. Day.
Good morning. How are you?
Very good, thank you. So we're going to talk now about what is really important to get on a ward round. The key factors that we need is we need our lovely patient, we need a junior doctor, hopefully coming with the consultant, and we really need a nurse. And it's really vital that the nurses are there for all the information that they can give us. One of the things that we need to just clarify is, having done the board round and been told what's been happening overnight, we need to just make sure that nothing has changed. And then we also need to make sure that we're looking at any issues that the patients might have and any questions they may have, any ongoing changes to medication or treatment, and they want to know what their plan is, don't you? You're pretty desperate to know. And at the same time, we also have things that we really need on the ward round. So we need the obs charts, and we need to make sure they've been filled in. We do look at these, so as much as other staff may not feel that the doctors actually do look at everything, it is vital. The drug chart that we always review on the ward round, and there's lots of elements within the drug chart that we need to make sure they're accurate and up to date. And then other charts such as Joe's got here, including blood sugars, fluid charts, diet charts and things like that. And they are really useful. They inform how we're going to manage the patient's pathway and help decide when we're going to be able to get the patient ready to go home. The other parts on the ward round that are really vital, particularly with the junior doctor, is making sure that we've got the TTOs ready. If we know when the patient's going to go home, make sure that the TTOs are done at least 24 hours in advance, if not before. And then also be thinking about getting the discharge summary ready, because the patient should be going home with their discharge summary on the day, and you don't want to be rushing around at the last minute to get that done. The other things that we need to do is, obviously, when we're explaining to the patient, making sure that he knows what the plan is. So for you, we've got a plan that we're going to have a meeting tomorrow, and then aiming to get you home within the next couple of days, depending on how that meeting goes and what care and therapy that we can put in place for the discharge. Yeah. But making sure that you haven't got any other questions before we leave and go on to our next patient and carry on the ward round as we're doing it. So all these elements to the ward round, having the doctor, the nurse, all the information at hand, may all seem quite small, but if they're not all done together, then the ward round can be really ineffective and inefficient. What we want to do is make this ward round work speedily, effectively and efficiently, so that ultimately we can get the patient home as quickly as possible in the most effective and safe way.